Hello and welcome to Health Bulletin. And today, we are talking about a silent but deadly global threat, superbugs. According to a new global analysis, antimicrobial resistance, or AMR, is set to kill over 39 million people by 2050. That's more lives lost to superbugs than some of the deadliest diseases we know today. The numbers are staggering, and the implications deeply concerning. Let's start with the facts. The study, published in The Lancet and conducted by the Global Research on Antimicrobial Resistance project, shows that by the middle of this century, nearly 2 million people will die annually because of AMR, up from 1.14 million in 2021. Superbugs, or bacteria resistant to the drugs that once killed them, are responsible for this. What's even more alarming is that AMR is forecasted to play a role in over 8 million deaths each year by 2050. The most vulnerable? Older populations, especially those in hospitals where infections spread quickly. Here's the problem. While AMR deaths are declining in children under 5, thanks to better vaccination and hygiene, but at the same time the risk for older populations is on the rise. And here you can see how AMR fatalities among those over 70 have skyrocketed by 80% in the past 3 decades, and by 2050, this figure is expected to rise by 146% globally. The elderly, already vulnerable to chronic diseases like diabetes and heart conditions, are now facing an added threat: hospital infections caused by drug-resistant bacteria. But this is not just a health issue. AMR has significant geopolitical implications. The study projects the highest future death tolls will come from countries in South Asia, India, Pakistan, and Bangladesh, along with other parts of Asia and sub-Saharan Africa. These regions are already seeing the fastest growth in drug resistance, but they also have the most to gain from better access to healthcare and antibiotics. And this is where global leadership comes into question. International cooperation is critical, but so far the world's response has been fragmented. Next week, global leaders will meet in New York during the UN General Assembly to discuss AMR. The stakes are high. They are expected to reaffirm their commitment to tackling this crisis, with campaigners pushing for a 10% reduction in AMR deaths by 2030. But are these declarations enough? Global powers, including the US, China, and Europe, have poured billions into vaccine development and pandemic preparedness. But have they truly recognized AMR as the long-term health threat that it is? Or are we still treating it as a secondary concern? The solutions are clear but complex. To reduce the death toll from AMR, we need a two-pronged approach: prevention and innovation. Better infection control in hospitals, access to healthcare in underserved regions, and the development of new antibiotics are key. But innovation in antibiotics is slow, and the political will to tackle this issue is even slower. As Dr. Mohsin Naqvi from the University of Washington pointed out, antimicrobial medicines are a cornerstone of modern healthcare. Yet resistance to them is growing faster than the global response. So here's the big question. If superbugs will kill more people than some of the world's deadliest diseases by 2050, why isn't AMR at the top of the global health agenda? The science is clear. This isn't just a threat for tomorrow, it's happening today. The clock is ticking. The world must decide whether it will act decisively or continue to let superbugs silently claim millions of lives. What do you think? Can global cooperation meet the scale of this challenge? Or are we too late? Thank you for watching. Don't forget to subscribe to Health Bulletin for more updates and in-depth analysis on global health issues and their impact on our world.